Okay, we're live. Where are my slides? Okay, hello. I'm going to do this in Hokkien, but just to introduce myself, my name is Dr. Malik. I'm an endocrinologist in Island Hospital, and I primarily treat diabetes and other hormone things. So today I'm going to basically talk about diabetes, but I'm going to try and do this in Hokkien. I may be at a loss for words at times, but just bear with me. So my slides. Now, the topic of today's right. So diabetes mellitus, the bare facts. Now, China Chelang, if look from Malaysia population, agak saja persen lang tinju, and China Chelang mcai ilang tinju. So Chile si tuasu because if lu mcai lu tinju lu be chia yo be ko lu be chia lu be kim chui lu be untong, and so is bunte because diabetes si你真正判病，伊会使做人嘅心有问题，会使做人嘅腰椎有问题。And 30% 人，你看，有30% 人唔知伊人有甜酒，so 这个是大数。And if 你看 Malaysia, Negeri Sembilan, Perlis, Pahang, 伊人嘅population of diabetes 是真正多，so 30% 人有甜酒。古早人讲哇，克兰丹嘅人 suka 食糖啦，but 唔是安尼看。Negeri Sembilan, Perlis, Pahang. And if lu tua Penang, lu suka cak nasi kandar lah, if lu tua Melaka jam-jam cak santan lah, kali kaliau si usu, and uco lang ubunte. So if lu kwa walang a National Health and Mobility Survey 2019, 1 in 2, gotcha percent Malaysia lang si either si overweight pui or xiao pui. So, female chaboga pui and Indian lang si che lang si ubunte. And if look qua walang statistics, gotcha percent lang e pato katwa, sila si lang kong abdominal obesity. And sila tan kalkong sila si tua bunte. So diabetes is in the belly. It's all in the belly. So if lu ulak liap is bo bunde, but if lu si pua liap or bo liap is tua su. So if lang e pato chiang tua is bunde because chile si lang e CT scan and chile scans le pet sex si you fat. Chile si lang kong visceral fat or abdominal adiposity. And chile e fat si kong 歹看呢，伊是内面伊会做人，伊出 hormone，and 伊会使做人讲 insulin resistance。So 你嘅身躯嘅 insulin 袂行，and 人会着甜尿，and 伊嘅 complications。So 这个是伊嘅 problem if 人有甜尿。So 这个是会白色是油 fat，and 这个内面是你看你去market 你去买嚟白奶嘅物件，你看内面是油嘅物件这个咯，伊係白色嘅物件。So visceral fat, if lu ai chai lu e visceral fat ka che or bo, lu just gya hale measuring tape nya. If lu e abdominal circumference si agak for female si pechap centimeter, for tapo si agak pechap go kauchap centimeter isi bunde. So if lu e pato ka lu e waist hip ratio bo siang, if lu e waist ka tua bigger than your hips, lu e buttocks ile si bunde, and chile lang kong waist hip ratio. So if you waist hip ratio katwa lang etio tingio because of the abdominal or adiposity. Now, anjolo chai if lu tingio bo tingio. Now, china che lang chai ilang u tingio because lang bo symptoms. Symptoms si lu ubunte lu complain ka lu kika lu e loko lu ka kai kong o wa kim wa tiam san wa tiam ame kui na tao pangju wa chia china che but be san bề bùi tầm tầm san and then lúc khoảng lúc tầm tầm ai lim chui ta tầm tầm lim tia mi kia but choose si bu bu hale si symptoms of diabetes if lúc khoảng le cheng hu lo kun chui poster long kong lúc bằng jiu liao and then hale ends lại ends lại then lúc kong si le si tin jiu so lúc ai si le si lu symptoms blood glucose monitoring, lu esai gia hale just testing, lu e hoi, lu ki pharmacy or maybe lu e beng yu hale lu just test one. Hale si e kalukong maybe ubunte, msi kong cepat percent chun. 如果ใช้รูปบุญเตบ่บุญเตสิไอขี่个嚟 lab or 嚟 check 个 hospital 落คุณชู I 看 if 你會通巴多嘅血是管無管，等我講，or 你會使啉嚟糖，我人講 oral glucose tolerance test and 即個會使100%甲你講你有甜酒無甜酒。If you check 你會酒，人講甜酒甜血是啥嘅物件？Actually 甜酒甜血是你會血糖，內面你會血是管。If you 放酒了，伊會糖出來，即個是甜酒。So it's the same thing，相嘅物件。So if 你愛知你有甜酒無甜酒，是 check 你嘅 oral glucose tolerance test，或話人驗血。If 你空巴多 and 伊嘅 level 是7.0 and above，即個是甜酒 diabetes。If 你是5.6加7.0，即個是 pre-diabetes。So if 你愛知你有甜酒無甜酒 ，if 你有 symptoms，then 你 check 一道，一個是關了，一個是甜酒。But if 你無蝦米 symptoms，人是好勢，蝦米無蝦米問題，你去 check，伊是關，你愛 check 兩道。If 兩道是關，then 人講你有甜酒。If 你嘅血糖是過11.1 11.1 random sugar，迄個是甜酒。So usually 我人愛check 你嘅血兩道 ，if 兩道是無 normal 無相 ，then 我人甲你講你有甜酒。or 有當時我人 check 你嘅 HbA1c， 這個是 special 嘅 test， 這個是伊會3個月血糖 average sugar for the last 3 months。這個較用 because 買空巴多，你 just 去 anytime 你去你會落群，伊抽你嘅血，去個 lab 看。If 這個是6.3 and above，我人講你有甜酒。In America，伊人講6.5是伊嘅 cut off point，but Malaysia because 真正濟人得甜酒嘅，我人嘅 cut off 是 lower，我人講6.3% 甜酒。So if 你看最最 who is at risk of developing diabetes？ Indians high risk， so 你別講 because 這個是 genetic factor，但係厝嘅人會得甜酒，你本會得甜酒。If 你嘅 family history of diabetes 是真正 strong， 你會得甜酒。If 你是 overweight or obese，that means 你嘅 body mass index 是 more than 23.5，伊是high risk。If 古早你 pregnant， 你有 gestational diabetes，then 你 after delivery 了，人應該是 normal 度對 ，but 伊嘅 risk 會得甜酒是差不多是8到10%一年。So 過10年了，100%會得甜酒。So if 這個是你嘅 risk factors，then I做 screening regularly so that 你會 at least 知你有甜酒無甜酒。Now 當今甲古早無相 ，if 你看 Malaysian 嘅 statistics， 當年真正濟人有得甜酒 ，and if 你看古早10年甲當今，伊嘅 statistics 較嚴重，什麼事 ？And 這個是 because of lifestyle changes。So 人無運動，人做工，more TV，點點看 Korean 嘅 drama 呢。And then 你無運動 ，because 你講你無點食，你住高雄坡，你早起你出了去做工，暗暝吧你來倒轉，無點食愛運動。金喙人無 diet，so dietary problems。So 點點去食，若是乾辣啦，暗暝3、4點去食肉骨茶啦，蝦米甲了是會做人會較肥。So 肥了，參 sedentary lifestyle，that means 你無做別項，你喺 office 嘅工，你當今你 MCO 你袂做別項嘛，你是點點 Zoom 爾 ，so 你無運動，人會較肥，人較肥了會得甜酒，so 甲了有關係。Now if 你講 OK pre-diabetes is treatable，pre-diabetes 是 in between，that means 你嘅血糖是無講真懸，無講 normal，伊是 5.6 to 7% 空巴多。So pre-diabetes 是problem， and if 你無顧你嘅 pre-diabetes， 伊慢慢會換個 diabetes。So problem 是 if 你無顧你嘅 pre-diabetes，pre-diabetes 我人會使互你食藥，叫你運動，啉喙蝦米甲了。If 你無啉喙，你無顧你嘅甜酒 ，and then 伊顧你嘅血糖，等伊甲換甲甜酒了，is a problem because it's easier to treat pre-diabetes than diabetes。So prevention， if 你會使 prevent 你嘅 sugar 甲關 and 換甲 diabetes， 伊較用。So diabetes 有3種 ，type 1 diabetes。 type 2 diabetes and diabetes in pregnancy, tamakalukong gestational diabetes, to pataw lang third trimester. So type 1 diabetes 唔是講地好地 eat 嘅時好，這個是平常是囡仔着 ，and 這個是伊會抵抗力做人嘅手無未出 insulin， so 細細漢囡仔拍針拍 insulin， 久長拍針。Type 2 diabetes 是普通嘅，真係濟人着 ，so 95-96%， 95% 我人嘅 patient 有着點着。So type 2 diabetes 我人叫人 diet exercise 食藥。then 慢慢是講伊個藥未驚食，3-4項藥未落，伊個血糖懸是拍針。So 我rasa是 type 2 diabetes 較有大事 ，because 人未 accept 人真正濟人 if 你有着我甲你講你有甜酒，你激心了，你莫過蝦米個了，伊是問題。Diabetes in pregnancy usually 是無問題 ，because 你愛過你個 baby 嘛，so 伊人有過伊會食有拍針蝦米個了。So type 2 diabetes 是問題。Now 做咩事我人 if 你有甜酒，做咩事我人愛互你藥愛做物件，互你個 sugar 你個血糖 normal 倒轉。Problem 是 if 我人互你藥，你個血糖會落到 normal， 伊 improves 你個 outcome。Diabetes 應該是 if 你無顧你個甜酒幾十年、幾十5年，目睭會歹、心會歹、腰子會歹，蝦米個了。If 你細細漢或者你着甜酒，你顧你個血糖 ，then 伊個 risk factors 你個 outcome 是 improve after 10 years。So 這邊我寫 diabetes is a disease of complications。So 伊會使做人食咩？目睭歹，目睭個血筋歹，伊會使做人個腰子歹。and 真正濟人洗腰子，伊是有關係甲伊個甜酒。stroke 風疝，真正濟人着風疝是關係伊個甜酒 and 心臟病。50% 人 if 你着是個 heart attack、acute myocardial infarction， 伊個 leading cause 是50% 人有 diabetes。So if 你 first diagnosis of diabetes 會有當時是 because 你着heart attack 了，你去 check 去 hospital， then 伊人 check 了看你甜酒，你個血糖真正懸。and neuropathy 是你會肩歹。會肩歹 that means 骹會麻、手會麻，伊會使做人嘅伊會肉會死，有當時有 ulcer， 人有骨骹，蝦米個了有關係 diabetes。So complications of diabetes， 你看 Malaysia， 真正濟人有 eye problems、nerve 會筋有歹，50% 人會洗腰子是 diabetic，and 濟人有心臟病。So 我人看 patients。First time 你來我 clinic， 你唔知你有甜酒，但我一 check 了，你看目睭有問題啦，筋有問題 ，maybe 伊個腰子有歹，但了是 because 人唔知，或你無顧你個甜酒。First time 你來 check， 有甲了有歹了。So complications， 這個你看，這個是人會家裡烏色了，這個是伊會白死了，所以這個愛顧伊個家裡。這個是伊骨骹 ，because 伊個甜酒做人嘅maybe 有 infection 或蝦米個了，這個是像 infection。So 這個是 problem， 伊真嚴重嘅。If 你着安尼款嘅病 ，that means 你嘅甜酒是久了無 control。這個是 normal 嘅目睭 retina， 所以我看安尼水紅色啦，伊個血筋蝦米個了是水水嘅。但你看這個，這個是 diabetic maculopathy， so 這個是血筋。and 這個是大事 ，if 你會講你個血筋 suddenly 會歹或有流血 ，patient 是未看到 ，because 伊個流血甲內面伊個 retina 伊個 vitreous，so 這個 suddenly patient 未看到會知咩？所以 if 兩邊本是安尼款是大事 ，so that's why if 你看你個落群，我人有 check 你個目睭 at least 半年、一年一度愛 check 你個目睭 ，make sure 伊無 until 伊安尼嚴重。把路做物件咯，所以這個是 mock cataract， and 有當時人會慢伊個目睭未看到 because of mock。這個是心臟病 ，and if 你看這個是大血筋伊個 aorta， 所以 if 人有甜酒，甲人無甜酒，伊個 aorta 個 specimen 無相，所以這個甲了迄個胃食嘅是由伊個 cholesterol 個 deposition，and if 你看 normal 個人無甜酒。if 你講你個 cholesterol 高，伊個心着塌是伊個血筋着塌，這邊你看這邊呀。 But if ลูก看这类是甜酒的人 diabetic 伊会经过了伊个调塔 so 你别讲 hair balloon or angioplasty 个啥物这类是人爱开刀了 so coronary bypass surgery so 相的病 but if 你有甜酒无甜酒伊的 effect 是无相 so good complications reduce the risk of good control reduces the complications. So that's why walang a patient. If you aside call you a tinjo, kong you HbA1c 是7% compared to higher level. If you aside tahan go jap ni, you a risk of complications a low jinya 7%, then 3-4%. So if you baru katio tinjo, xiao lian, walang holu yo and lu esai ko lu tinju and lu esai tahan ko chap ko ni tan lu ka lao liao or lu ka lao ye hui teng a complication rates u ka low. So that's why isi walang every time walang a patient lai walang kai lang kong lu ai ko lu tinju because if lu esai ko lu tinju lu complications ka chiu. So targets if lu lai any doctor ilang kalau kong okay lu targets targets for treatment si usually si walang measure sangkagoi hoiteng HbA1c so chile si limbo rock how low can you go limbo lona limbo rock so if tinju si siang lu ai chai si how low should you go so that lu assign reduce lu rates of complications so every 3-4 个月到walang một hồi and walang check lu ALG la cholesterol la hami kalao but walang will check HbA1c HbA1c is the average sugar for the last 3 months and walang kwan patient tatalang bo siam lu si gina lu si xiao lian wa ai lu sugar control jinya tight but if lu si kong lao liao a pwa si liao hami kalao walang kong okay look at maybe lu HbA1c is 7% 7.5% ne anelo so individualized goals that means tatalang bo siang if lu lai wa kalu u chile contract wa kalu kong lu hoi tang si ai ane level so prevention is better than treating because tama kalu kong liao if lang u pre-diabetes it's easier to treat than if lu tio tinju liao so prevention is better than cure because once patients see diabetes liao susah lo okay so now how do you treat well if walang ai holang chia if wa kwa chile patient we kong see a patient lai tua chepeng ai cham siong okay ai cho hami problem si reliance on the patient if lu ka kong okay wa rely ka lu cho hami ka liao wa toi lu nia si eng lo but chinya che lang patient i bo toi lang because wa ai kyo lu kim chui that means lu be sai kong hi luan chia la koi ji be sai chia la ai chete la durian ai cha che hut la hami ka liao so diet is very important if lu bo kim chui lu chia hami yo pun lu hoi thang be lo second si untong lu at least tadajit ai po tem cheng if lu ai ka san dampo because chinya che lang mo tin ju si pui ma so if lu ai san dampo lu ai tadajit po tem cheng ai untong si mai kong ki jogging if lu chap ni di chap ni bo cho po hang suddenly ka jogging ka hami wa po si lo so ban untong cho maybe kia cho morning walk la cho stretching la hami ka leo and then lang a fitness level ka okay then lu cho ka hiong e mi kia lo okay now lu yo walang if lu tin ju usually walang ho lu yo msi kong chang tin ju yo la maybe si chang no hang sa hang maybe upachiam la hami ka leo so combination of tablets and usually patients ka lang kong wa doctor na wa be thun be lo cha lu yo ne wa pa leo wa be cha mi kia so problem si yo si chi ja che hang and ye yo si kui u fu cha yong hami ka leo and then lu ai toi if wa kalu kong lu yo si ai aboi cha mi kia lu ai cha chile yo en lu ek tiam sia bo chun ye yo pe kia so siang wa ka patient kong if lu ek gu chao le ba lu ai kham mui si too late lo okay so insulin si phachiam yo and chinya chelang mai phachiam because ilang kia ye peng yu kong wa ye ama phachiam leo e si so lu ka lai che peng gao kong lu mai phachiam yo bo giam tiong walang u gina se hane gina phachiam so insulin si chihang yo walang usually ka patient anjo ai phachiam and kaleo yo si u effect and u fu cha yong that's why lu ai cham siong and usually wa kalang ka patient kong lumai ka kicholo kun susah lu kaki kibe yok lah hami kalau lu mencai ubunte bobunte. So belief and myths. So jinya jelang suka tiang kong. Okay, ilang believe that insulin si tiang tiang lupa insulin yao si bunte. And then ilang kong oh to kun wa mai chia yo because if wa chia lu yo tan wa yo chi pai la I say yo chi la hami kalau but lang bo bimpe if lu chia yo ye sai ko lu tin jo if lu bo ko lu tin jo lu yo chi pai say yo chi so im si kong 有机有机派是有是 because 你会疼无水，正久如这安尼好了也有机派。So 伊人 suka 吃 herbal medications. 你去 bomo 啦、灯笼先生啦，哈咪个了 and traditional medicines. But 你买吃红毛的药，红毛的药 proven track record. 伊人做 clinical trials 啦，check 哈咪个了，无副作用无哈咪个了。But if 你吃你 herbal 的物件，你唔知嘛，有问题无问题。So another possible problem is if lang kong wa chia lui yo chale pai wa lu kun lu ane gao wa chia no le pai liao lui wa hoi thang sui liao so I theng lui yo. So if lu theng lui yo then lu bo ane gao lo so ye hoi thang e ka kwan to tui. So usually lang lai kwa wa then I kwa tia then I tui e peng yu kai kong lu mai chia yo so I tui e peng yu lo. And 有当时人讲哦，我打打去运动啦，我 exercise 我金嘴了，so 我咪食药，安尼咯。So 这个是 the challenges of treating diabetes. Now if 你问我 if 人有甜酒，你爱做，爱 check 下面，爱 control 下面。这个是我的 patient，OK？有朝我有一个 patient 一来，他点点来，点点穿这个 T-shirt，这个是 Leonardo DiCaprio and Kate Winslet，这个是 Titanic。So Titanic 是你知嘛？the ship hit the iceberg， so 搞了人死了。So 伊人无看，if 你人有甜酒的，伊是像 Titanic 安尼款，because 你唔是讲顾伊的甜酒呢，你爱顾伊的 cholesterol 啦，你爱顾伊的 blood pressure 啦，伊爱顾伊的 glucose 啦，卡了。So if 人有甜酒，伊是真济物件。So 你来是 maybe 你的药是3、4项是甜酒的药，一项是 cholesterol 的药，一项两项是 blood pressure 的药，血管的药。maybe 有减血的药，maybe 你有心脏病的药，so 真正济项药是问题，and 你袂使讲点点suka-suka食药，suka-suka停药安尼款。Now problem 是 diet，first line of treatment if 你有甜酒是 diet，and problem 是你大病人，哇，这安尼好了，so 安怎？袂顾咯，so patient 讲，哇，老公啊，我爱对路，but 我袂使对路，because 我安尼咸，爱食kacang啦、laksa啦，哈咪个了，安怎啊？So if 你爱 diet， 你爱 control 你的 sugar， 你的 blood pressure，maybe 莫食安尼盐啦，莫食安尼甜的物件，莫食安尼，你莫食油的物件，你爱 if 你袂 control 你的 diet，我人 refer 你个 dietitian，and dietitian 会使教你安怎爱顾你的甜酒，and 顾你的食，哈咪个了咯。So 我人唔是讲你袂使食，会使食，but 你爱食淡薄济豆。And 我的 patient 我甲伊人讲，你当时你爱食 durian，哈咪去食1-2粒是不要紧嘛，袂死的，1-2粒会rasa at least 人欢喜。But 你袂使讲点点食2-3 kilo durian 袂啦。Exercise，打打节半点钟，爱做啥物 exercise pun不要紧，as long as if 你袂行，你的脚有疼，你摇摇，你的手pun是不要紧。If 你会行，你会 morning walk 去半点钟，if 你会使去 jogging 去 jogging，but 你爱甲你的老公讲，你爱运动，so maybe 我人会使电心 check 看 if 你的心有问题无问题，也袂做物件，我惊你的心会着读。Weight reduction. So if 你的瘦淡薄是好，if 人有甜酒，我人叫人瘦5到 maybe 10%。甜酒的药，伊的副作用是做人会较瘦。So 迄个掺 diet、掺 exercise 会互你瘦淡薄，and if 你会较瘦，伊的甜酒的 control 会较好。So choosing the best，安怎我人知爱互你啥物药？So if 你来看我，我爱知你的 HbA1c。So if 你的 HbA1c 真正悬，讲14%，and 你的 target 是6.5%，I look 这项药会 look 8%。 So if lu chia no hang yo sa hang yo maybe lo 3%. But if lu e hoi thang jinja kwan utang si walang holu pacham yo. So choice of medication depends on HbA1c targets. If lu e hoi thang jinja kwan why ho lu si chipeng wa ai la holu chipeng si bunde lo so oi wa ai holu maybe no sa hang yo ka hami. So walang e cham siong kwan choosing the best medication. If lu si jinja pui wa bo holu yo e holu ka pui e wa ai holu yo e san. If lu si lao liao wa mai holu yo tan until ye hoi thang jiang lo until lang peng san ga hami si hu hui hiam. So chile si selection of medications. If lu sim chong pe maybe wa be sai holu chile yo maybe I holu hale yo. Si anelo if lu e yo chi ubunte maybe wa be sai holu yo I holu pa cham yo. So patient preference. If lu ka kong okay lo kon wa mai pa cham wa kya maybe wa I try adjust lu e yo before wa holu pa cham. And most importantly si cost. Chỉ nhá chế hàng yêu si quỳ and tông kim nu chả lẽ cả lẽ lăng con covid la bị chỗ căng la mi cả lẽ so yêu si quỳ but if lu bo lui or quỳ im si con lu bị sai call lui tin chiu u yêu cả lẽ lăng u yêu so u Ferrari yêu u căng chế le yêu wa lăng sai ho lu and if lăng u pregnancy if lăng u sin to pato that means yêu bo siang maybe si pa chia me yêu chỉ anh lo so walang Malaysia has guidelines for treatment of diabetes. So, walang msikong, how do I say this? We don't dream about what medications to give you lah. There are guidelines. So, walang u guidelines I holu hami yo if lang overweight, lang normal, lang kong lu yo chi pen lu sim chong pen lu heart failure lu sim bolat hami kaleo walang u yo and walang u guidelines. So, walang I wan lu yo I chao lu yo si anjualam. Now, insulin therapy, if one holu, if what kyo lang pachama, utang si lang kong ayo, puan si liao, utang si lang u hao la, utang si lang chao ki, maybe why my kwan wa liao, because what kyo I pacham so I kwan pakai lokun no, maybe hale lokun kyo I jay yo, nya what kyo I pacham si ane. But insulin actually bo kiam tiong. Insulin, im si kong do I puan si liao, balu I pacham. Walang holu insulin because lu e hoi ten jiang kwan or maybe lu e normal e yo be kian. And normally if was start insulin, ye insulin a device ye pen si anenia. Okay. So if lu to wa clinic normally wa first injection wa holu wa pa liao. And ping xiong si ya ka lu kong jinya che lang wa pa liao ilang ka kong oh anenia. Because ilang kwan ye jam. So ilang e imagination si siang wa chile si sang drug addict la ye tua jam la hami ka liao but chile ye jam ane se so if wa demonstrate kalu wa pa liao if lu kau kau oh ane nya lu chai liao okay la bo su so usually walang e kalu anchua ai pa jam anchua ai store lu e insulin la ai has sentu mai has sentu anti ai pa jam aboy chia ane kwan ami kalao walang kalu so walang wa diabetes educator usually e kalang anchua ai yong chile insulin so that bokong ane mawan and injections if wa kyo lu pacham e yo msi insulin nya uchile sine yo for example Ozempic Trulicity chile si sine yo GLP-1 receptor agonist and chile is cholang e hoi thangalo but ye fu cho yong chu is cholang ka san lang be chia ye hoi thang e lo I ka lu e nao kong wa pa liao ha mai chia so chile yo hami ka liao si lang jiang pui lang u tin ju lang ai san walang pa ne kwan e yo I e chu lang ka san lu kwan ta lang bo siang but utang si lang u san no sa kilo chap kilo kun u so chile ai mui lu e lo kun si ngam be ngam problem si u ka kui tampo but as I said hami yo pun lu ai cham siang lu ai cham siang ka lu e lo kun kwa hami yo e ngam ka lu or hami yo be ngam because ta lang bo siang now utang si lang u tin ju lang u kong jia pui so walang maybe a suggest bariatric surgery bariatric surgery si kuito and normally walang cho chile vertical sleeve gastrectomy so chile si lu e ui ilang kui sa si kang I dip e scope and then ilang kwa e pato so e ui so hoi ka se tampo or se che and then if chile get chulai liao chun chile nia if lu chia lu be lu kwai pa so lu chia liao lu chia tampo lu rasa wa pa liao so lung e ka sun maybe chap go chap go percent. So chile it cho lung u tin chiu maybe a reverse lu e tin chiu and it may extend your life because it cho lung e hui bo quan e sai ko lu e cholesterol ha mi ka liao. So chile si one option if lung nya pui u ane kwa pe kong lu hong sip la lu chong khui be si bo tòa xe snoring. So Chile a Holland sun and bariatric surgery may extend your life. So if lu like Hua, Hami lokum bona if what Walang. Normally first visit Walang Hua lu I check kaleo. And Walang Kalu ancho I call we tinju. Kalu ancho I check lu e hoi tung tua chu lu test lu e meter. And what expect luga at least sasi go jit tao lai check Hua if lu e hoi tung e lo if lu yo e ngam or e kia or bo kau lat hami and then walang esai adjust chao lu yo walang check lu blood pressure maybe check lu weight HbA1c tama kal kong se kujit sang kujit e hoi tung and then walang discuss e results annually at least chini or 半年 chỉ tao walang check lu tan ku sun la yo ji la hami ka liao check lu bat chu make sure lu bat chu bo bun te check lu car make sure lu car e kin hami ka liao si okay bo lu ka bo gare bo hami bunte and Chile si irregular visits. So walang expect lu to at least lie kau ka walang a clinic walang check and do a expectation si lu ai check lu yo toi walang a dietary advice ka lifestyle advice. So in conclusion, diabetes is yang lu COVID pandemic lo. Tatani ikahyong. And if look for Malaysia rates, walang rates is such a percent, maybe 20 to 30% lang utinjo. And problems is yang lang jai lu utinjo. And it's associated with lifestyle because walang lifestyle tangkin bos yang bujai ma. And prevention, that means if lu utinjo, kahosi prevent the diabetes and lu aside start with lu children. Ka lu gina ki untong la, mai hoi lang junk food, healthy living, hai kyo ilang games kalau video games ka hami kalau kacau ko ki park you or bicycle ka hami kalau so choice of treatment si lifestyle change tama kalau kong chia yo ukuina hang yo surgery kuito tama kong bariatric surgery and all of this ai cham chong ka lu e lokun em si kong wa chelang nia la chia chelang e kwa lu but lu ai cham chong and kwa hami yo ngam ai cho hami to call lu e tin chiu. Thank you very much. Okay. Oh, I got questions. Okay. What's the question? My fasting glucose is okay. So someone here says my fasting glucose is 5.8 and my HbA1c is 6.1. And then when I rechecked it, the fasting sugar went down, but the HP went up. Okay. Fasting HbA1c, I have to explain this in English. The HbA1c is a reflection of fasting plus postprandial. That means 2 hours post meal glucose levels. So if your fasting is coming down, it probably means that overnight you fasted for a prolonged period. But maybe the sugars after the meals are on the high side. So what you need to do is if your HbA1c is going up, it may probably means that you need to watch your meals, your mealtime or your postprandial sugars are the ones that are probably on the high side and you need to cut down your carbohydrates and your sweets. And the other thing that problem always causes problems are fruits. When you allowed a portion of fruit, one portion is just one small piece. So if you take, for example, a banana, it's one banana, maybe we're allowed to take one or two bananas a day, and that's it. If you take an apple, it's a small apple a day. If you take an apple and you mix it up with durian la, or maybe with pineapple la, whatever it is, each slice of fruit that you eat actually has a lot of sugar in it. And this actually causes a lot of problems for diabetics, especially after the meals. So if you feel that you need to eat something during your meal, you can try oats, you can try brown bread, you can even try lots of vegetables, but try and avoid snacking too much on fruits because fruits are extremely sweet. Okay, next question. Okay, ulang mui wa kong esai chia honey. If lu tin ju esai chia honey. Honey is trong tea. So it is sugar. So even though it's yeah, sugar may not be um, uh, complex sugars, refined sugars, but it may be simple sugars, but it's still sweet. So honey has to be, you have to be careful. You can, if you don't believe me, you can check your sugar levels after taking honey, 1 or 2 teaspoons. After that you check and see it's going to be on the high side. So basically, as I said, with anything that we do in life, you can take it, but do it in moderation. And honey is not the treatment for diabetes, so don't use that as a means of treating diabetes, as some patients sometimes do. Once start insulin, possible to go back to medication. Okay, if 有人问我 if 讲伊食药了伊会疼，讲伊会疼关我互伊拍针的药 so 拍针了伊会疼是水水 so 伊问我伊的 insulin 会停袂停 so 你要看每人无相 so if 当时 if 你会 first time 你来看我你的药袂惊你会疼真正关我互你拍针 after about 3 to 6 months 你看你的血糖是慢慢较落了 it's possible 有当时人讲 it's called glucotoxicity. That means 你的血糖它做人的 pancreas 会笑不做工它 toxic. So if 我互你拍针的药 insulin 它的血糖它较 normal 有当时 if 你会较禁嘴你的 lifestyle 是无常了有当时会停它的 insulin. So 这个你要参详甲你的老公问伊看会停袂停。 Next, same person. Any side effects of bariatric surgery? Um, Bariatric surgery, not really. I mean, any surgery can have problems. There's always, because it's a general anesthesia. But bariatric surgery, especially sleeve gastrectomy, is a very simple, straightforward procedure. They do it laparoscopically. Patients stay in hospital maybe for just 1 or 2 days. So it's relatively simple, but not there is nothing in life that is no has no complications lah. There's nothing that's 100% safe. So there will be problems. So if you want to discuss bariatric surgery, there are 2 doctors in this hospital who do bariatric surgery, and they do good work. So, but what I can tell you is that it is generally very safe to do bariatric surgery. Okay. Anybody else besides Jocelyn Tan? Intermittent fasting can cure diabetes. Okay, pre-diabetes. It's true. If you basically pre-diabetes, the treatment for pre-diabetes is diet, exercise, and sometimes we use medication called metformin. Okay, so in all the studies that were done, diet and exercise actually did better than giving someone medication. So intermittent fasting is basically a form of dieting. So yes, it will help you actually control your pre-diabetes. What is the chance of pre-diabetes going back to normal? Okay, in someone who is pre-diabetic, if you can lose about 10% of body weight, which means a reasonable weight loss, there is a 50% chance that you will go back to normal and not progress to diabetes. So it's encouraging, and that's why we tell patients that you should actually be trying to control the pre-diabetes very aggressively so that you don't progress to diabetes. No more questions. Okay, with that, it's been a pleasure talking to you, and thank you very much. Done. Okay.